So IOP programs are any programs that include 9 or more service hours of treatment per week in either group or individual counseling. And these are really great programs for people who have busy lives. They work, they have childcare, but they also need clinical structure and education on how to treat a drug or alcohol problem. So intensive outpatient programs, or IOP, allow people to come to treatment on a consistent basis throughout the week, but also meet their needs of daily living. Intensive outpatient is a really good type of program for 2 types of people. The first one being those who were previously in an inpatient program, whether that was a medical detox, long-term residential, inpatient care of some sort, and IOP offers them a step-down level of care. Often it's very stressful to go back into your daily life. Inpatient treatment offers a very protective setting where odds are somebody's not going to be able to get high or intoxicated in that treatment setting. When they come out of treatment, they go back into all of their stressors and are really vulnerable to relapse. So what IOP does is it keeps them in a very intensive treatment setting where they can remain accountable, be drug tested, and continue to build relapse prevention skills so that they can sustain the abstinence they initially achieved in inpatient care. The other type of person that IOP is really good for are people who are able to achieve abstinence on their own but have struggles with maintaining that abstinence. So they come into IOP initially, they're already sober, but in IOP they begin to develop a skill set to help them sustain that while they're in treatment and then once the treatment program ends. All of our intensive outpatient programs consist of 3 group sessions per week in addition to a once weekly individual counseling session. The groups consist of a variety of topics where people can learn to prevent relapse, identify what their triggers and high-risk situations are, and we also incorporate a family component in that. So family members are allowed to come to one of the groups each week, participate, and begin to build a recovery of their own. The individual counseling is really where we kind of tailor to what that client's specific needs are. The substance use is always an issue, but a lot of times there's other issues as far as anxiety, depression, family issues, and in the individual counseling, that's really where they work with a therapist one-on-one to meet specific treatment plan goals to address those needs. We offer several different IOP programs. Currently, we have both a day and an evening program at our Northwest location, and then we also offer an evening program in a Henderson location. This allows us a lot of flexibility to meet the needs of different populations, people with different schedules, especially in Las Vegas, where we're a 24-hour town. We really have the availability to meet different people's needs in terms of their individual schedules.